Hello, this is Sabrina with Young's Daughters Funeral Home and Bereavement Center. This video is going to be about the relationship with CareAge and the Bereavement Center. I'm going to go ahead and get started. If you'd like to take the platform and introduce yourself, ladies.
I'm Viki Smith. I'm one of the co-owners here at CareAge Home Care. This lady to my right is Joanne Walters. She's the other co-owner. And this lady to my left over here is our care coordinator. This is Brandy Williams. Brandy goes and services all of our clients in the field to make sure our caregivers have every need that they need to care for our elderly people.
Well, fantastic. Thank you so much for joining us. So with your care coordinator, when admitted to hospice or into your business, what are some funeral-related questions and planning that you offer?
Currently, because of our non-medical status, we have to rely on our hospice. We have to coordinate with our hospice agencies, and we need to rely on them to direct the families as far as funeral homes and bereavement and what all their hospice services. So we at this point have been kind of taking a step back and allowing the hospice agencies to deal with that. We would love to be able to have more education in that, to where we could also join in that conversation because of the time that we can spend with our families, because sometimes we're there around the clock.
Okay, so tell me about your company. How do you help your family?
Our mission is to help our elderly people remain in their home and not be in a facility type thing. So when we look at what is it going to take, as long as it's financially feasible for that elderly person to stay in their home, they need assistance with their personal care, safely to get in and out of the shower. They need their meals. They need some light housekeeping to keep their environment. Laundry, everything basically that you would do on a day-to-day basis that we all do. Those functional activities of daily living. It's just that when you're a senior citizen with arthritic shoulders and everything else, it's hard to do to maintain your home, as well as to have someone make sure you're eating properly, reminding you to take your medication. And that's what we do. So our goal is to provide those services to keep you at home as long as possible.
Great. So with the shelter in place, are the patients and family, are they coping well? Do you see them coping well with everything that they're having to do within their homes? What do you see?
We do see them coping very well. One of the beauties of what we do is we have several families that we care for right now that have no immediate family in the state. We are that. So it's up to us to maintain those protocols, those that are dictated by our governor and our president and the CDC, to make sure we're following all of the protocols to still be able to go into their home and care for them. Where we're really limited at this point is we don't want to take that elderly person out to the grocery store and stuff. So it gets hard for them because they're so confined, and especially if they have some memory issues, they don't always understand why they can't go outside, to the mall or wherever they're used to going. But other than that, we're essential. And so we're still able to maintain. We've not had any discouragement from other families about don't come in the house and things of that nature. And we are working with several families right now in coordination with some hospice agencies, and we're seeing those people still working as they should be with their patients in that regard.
So with the pivoting your business model right now, because you're having to do grocery side pickup as opposed to actually going to the grocery store for them, and if they don't have loved ones near, are you able to offer a tablet or some type of Wi-Fi that they can connect with their loved ones through internet?
We haven't been able to put that in as of yet. We actually had a webinar yesterday with our scheduling system that they have now updated that software to where once we get it implemented, we now can do that. But the caregivers are wonderful about cell phones and FaceTime. So with the family members, and so we've been able to maintain that, for the families that live far. So thank goodness for FaceTime and that type stuff. A lot of them surprisingly have Wi-Fi in their homes because of their TVs, in those programs. So we've been able to do that really well. One of the beauties about having a care coordinator, especially when you have senior citizens who cannot be left alone, is our care coordinator, the caregivers can work up a menu plan and a grocery list, and then our care coordinator can go pick that up so that we have less traffic through that home that's been out in Walmart or grocery or whatever. So it seems to be working very well right now.
So well, good. I'm glad we're able to be bedside and still be essential in your business, because it's very much needed. And so we definitely hats off to you for that. What kind of support do you see locally for bereavement? What do you see? What do you recommend right now for people?
Well, I'm so thankful for our conversation today, because I do feel it is a much needed situation. We as I mentioned to you earlier, we have a very much example right now where a phone call is not. It needs to be more than a phone call. A lady lost her husband and she's young, and she has no family here close by. She has family, but they don't live close. And with the restrictions in air travel and everything else, she's pretty much, on her own. So when I investigated with the hospice agency, I said, what will y'all be doing for bereavement and stuff with her? Well, we'll make sure that we give her a call. So I do think there's some lot of things missing in that post-death grief counseling to help these people kind of know, I'm okay. I know that the funeral home that she used when her husband passed away are personal friends as well. They went to church together. So she did have a little bit of connection there, but still he passed away on the very day that we all were ordered to shelter in place. So therefore, that's been my concern for her for a long time, is what is available out there to help this dear lady, go through some tremendous grief, I'm sure, because of, her husband was only like 64. He was a young man. And so what's available for them?
Right. Well, there, hopefully with the bereavement center, and once the shelter in place lifts, we do have Widows Connections. It's a group where they transition themselves. We even have a stylist who even does a full makeover just to try to make them rediscover who they are or who they want to be on this new grief walk that they have. So that is something I see with widows, that they don't know how to reconnect. They've been married for so long, they don't know how to have even a flirtatious conversation when they're ready. So with our Widows Connections, we host potlucks, we have meetups, we go dancing when the time allows, we go to movies, because what happens is you get so comfortable with knowing what your spouse wants to watch, you forget what you even like to watch. So we want to make sure that they have a safe place to rediscover themselves. And I think with the Widows Connections, it's going to be very healing. And so that would be a great resource, definitely.
Absolutely. Thank you for sharing that, because I do need to pass this information on to Sabrina. I do.
Let's see. So do you see any special events around town? Do you see any special events, or do you host any yourself that help families come together to share grief?
But I'm sure that is that a baby?
That's my 7-month-old. Yep.
Boy, girl.
We have all daughters. We have 5 daughters.
Oh, good for you. Good for you. I'm the oldest of 4, so I kind of walk that path. I'm sure some of the churches, have meetings and groups, and stuff. They're wonderful about that. But as far as everything out of, out in the city and stuff like that, I'm not aware of.
Okay.
I think it would be more our churches that would be more focused in that arena.
So do you notice that the hospices have a yearly, around Christmas time, they have a big memorial service of all the people that they lost. Have you seen that published
No,
anywhere?
no, I have not.
Yeah,
No, but you're going to do that, right?
I am.
Good.
Well, with help, of course. Yes.
Of course, absolutely. I'll bring the tree.
Let's see. Do you see any fear with the families afraid to partner with the funeral homes, where they're scared to make arrangements, or they feel that it's a very elephant in the room type of topic, and they just aren't comfortable talking about it? Have you seen that with your families?
Um, so I think it's kind of a 50-50 situation. It's once they hear that word, terminal or hospice, it does kind of spark a reality for them that, oh, we need to get that into place. I do know that some of the hospice agencies that we coordinate with here in the city, they're wonderful. Those social workers and admission people are wonderful about directing. Now this is terminal. One of the things you want to consider is go visit with, pick out a funeral home and stuff, and go ahead and make those. Or you may not need it for a year, but go ahead. So they're wonderful about encouraging that. But most people, it depends on the people. I can only speak, for example, with my parents. When we lost our mother and 6 months later we lost our father, one of the things and they were neither one on hospice. So one of the beauties that they did for us, and we considered that the gift to us girls, was they had everything arranged and paid for. It was a simple phone call, and that was it for us. We didn't have to go through, well, do they like this? We didn't do that, mom and dad. And so that was the blessing and the gift that they gave us, all four of us. Different families kind of see that differently. And so it's an individual thing, I think.
I agree. I definitely agree. Have you noticed the veterans? Do you do anything for them specifically? Is there any way that you honor them or separate your services for them specifically?
We have in the past a little bit. Our focus is more on the surviving spouse of the veterans. There's some stuff for aid and attendance that helps them stay in their home. And we work with a company that's a liaison between us and them to help get them qualified for aid and attendance. And it does help kind of reduce the cost to help them stay in their home. So our focus is more the surviving spouse than the actual veteran himself. And I'm speaking about male veterans, not female veterans, but for their surviving spouses.
Okay. Let's see. What are your hopes for our bereavement center? If you could have painted the picture, and this would have been in your own mind in the beginning, what are your hopes for it?
Oh, I think the worst thing that can do for our widows, even our widowers, is to isolate. That's concerned me for a number of years. Some have good family members that can connect, but we live in a world of families being so distant that they can't always be there. And I know senior citizens are very resistant to change. So just to be able to know that there's a place where they could go and interact, with other people and kind of help them just kind of sort through that, hey, I'm okay. This is a normal process. How do I do that? I just think that is such a need. And if they will only participate, it will certainly benefit them tremendously. I think I'm so excited to hear of this center that you're going to open. Congratulations. That's awesome.
Good. You're making me excited. So thank you for that.
Well, I want to, because when you first called me and introduced yourself with this, Sabrina, I told you then I want to know more, because there is a need. There's a tremendous need. And I have this lady on my heart. I've had her on my heart for a month. And I thought, what do I do? Because I can't go in over there. Now, whether she'll reach out or not, I think that's the challenge, is we can only say, but how do we get them to reach out? That's our concern.
I definitely think with your relationship with her, and saying, you know, I would definitely do this myself, and having that reassuring kind of support really helps the relationships. A lot of times people go to call me and they say, I know I don't know you, and it's going to be an awkward to start the relationship. So when you are present, or you know, being available. So we have many ways to talk about the transitions, and we have done it where we go to a spa and we all get a manicure or pedicure, and we just talk, and then we build our relationship that way in the hobby of that person. So if they like to golf, we're going to go do 18 rounds, and we're going to talk until, you know, we're ready.
I'll take you up on that in a heartbeat.
Yes.
Yeah.
So we also have what I had mentioned is the Death Cafe. So even though it's not a grief meeting, it's a very educational piece, and it allows the flow of a conversation. We've also partnered with, um, Lord, it just escaped my mind. A Talk of a Lifetime is what it's called. And it's a card game. And we sit around, we drink coffee and have tea, and we play the card game. It's just a simple card that talks about something that's self-reflecting. And it really stimulates the questions that we need to focus on. So if you ever get stuck and trying to reference people or trying to bring up the topic, we have a handful of ways to start that conversation if it seems like it's an elephant topic.
One of the things that comes to my mind, as I know you have people that are partnering with you and able to, you know, all of the creativity and all of those things, but take an agency like ours that we don't deal with the medical side, we don't deal with the health side, and we certainly don't deal with the hospice side. Our focus is just like you would do if you were caring for one of your parents in your home. You would have to, or children even. It's the same activities, you know. So we're not really focused with that, but because we're so inexperienced with the grief process, really, you know, what can you do for us to help us maybe have those right words, or those some way to approach that? You know, is there training for agencies like us that are non-medical?
Yes, absolutely. So we are gearing up for CEUs for any home health, social workers, caregivers. We want them to have the resources that they need to have the discussion. So we will have presentations, webinars, and CEUs that offer different platforms to start that conversation, what you can do, how to get a POA, how to get an authorized agent set up for them. Because these are things that a lot of people don't want to do right away, or they forget to think about, oh, I won't need that, I have this. And it's very important. So we'll talk about what an authorized agent is. We'll give you the forms so that way they can get them filled out. And then with our free notary, we'll notarize them all and give them back to the families so that they can have on file, just to make sure that their paperwork is in order. It's very, you know, safe to do that and needed.
Yeah, Sabrina, one of the things that we notice is we have family members that, like we just took on a new one yesterday, that has been diagnosed with dementia, Alzheimer's. They do not have anything in place. They don't have a POA, they don't have a DNR, they don't have they have nothing. So that to me is what always is amazing, because these people are not young. You know, they're quite elderly. I mean, we've got one right now that's 101, you know, and yeah, but fortunately her son was kind of up to speed on things, and so they have all of the legalities in place. These people, and so now, you know, you have a person with dementia. How do you get that into place when you don't have that power of attorney medically or business or anything else?
So home health families, what they do is they find out who the caregiver is that they will be coordinating with and talking to, just to follow up with. And so they say, if you'd like, I'd love to send you some information. So with our partnership, you'd be able to hand deliver that to that person, or if with their permission, you can share their address, and maybe they're not there in that home and they would like the material to go somewhere else so they can reflect on it. You would share the address and we can mail them, you know, here's step 1, step 2, step 3 to get your affairs in order.
Yeah, because we always ask that question, you know, because we're there and sometimes it's a 911 call. That's the first thing the emergency responders, you know, ask for. Do we have a DNR, you know, and what's the list of medications? That's the first thing they ask. And who's the power of attorney? Well, you know, she doesn't have one, but here's her daughter, you know, and it can get to be sticky because they can't transport. They can't take the word of the daughter to transport if there's not a POA. And
right. Right.
And so
and
we've run
also having the appropriate DNR. It can't just be generic. Whatever hospital that they are coordinating with, Stott and White, for instance, has their own DNR, and it has to be with that doctor's signature on it. So knowing in our DNR class how to have that conversation and make sure that they have the appropriate one, because the ambulances do check to make sure you have the appropriate one.
Yeah, because that is we run into that all the time. More so than you really realize. I'm into that. It's like, oh, you do have that in place. I'm shocked, you know, because we always ask, you know. So go from there.
Well, I want to thank you, ladies, so much for your time. And
you're welcome. It's been a pleasure to meet you and to hear about about your bereavement center. This is awesome, awesome, awesome.
Well, I certainly look forward to our relationship and friendship.
You bet.
Amen.
Bet. You're welcome. Anything you think would be helpful, you have my email, you have my text. Feel free.
Well, thank you so much, ladies.
Yeah, you have a question? Joanne has a question.
Okay.
If you go on our website, okay, another angle of why we got started, etc. I did a video that was recorded that they put on there. It was spontaneous. I just assure you of that. But that will give you a background of why we're doing what we're doing, and then how we really feel in a different way. In other words, put the two together and you've got it.
Yeah. It's a lengthy video. Skibo did that for us, and he just couldn't find a stopping point for Joanne. But it really does see the heart of this business, and so you're welcome to do that. So anyway, God bless you, girl.
Yes.
Thank you, ladies.
You're welcome. We'll talk to you soon. Okay.